Kelly Dawes has an entire drawer in her refrigerator filled with medication for her diabetes.
And this is all monthly, just the injectable part.
She has another drawer full of medical supplies in her bedroom.
So this bag has pills I take at nighttime.
And then there's a third drawer packed with even more stuff. The amount of medication and supplies Kelly has is typical for someone with type 1 diabetes.
Without taking insulin or injecting insulin, we die. I require insulin all day, every day, as my body doesn't produce insulin at all, which is what type 1 diabetes is. So I manage with a continuous glucose monitor, also with a manual finger prick glucose monitor, and then wearing an insulin pump.
In addition to insulin, Kelly needs a continuous glucose monitor, cartridges, tubing, blood sugar meter test strips, alcohol swabs, pen needles, and emergency hypoglycemic treatment. And all of that adds up to huge costs every month.
Insulin prices have just peaked. They've skyrocketed from years ago. They've gone up so much, and it's become a barrier for people who are having now to make choices between paying rent or buying food or paying for the insulin that they absolutely have to have in order to survive.
Kelly was diagnosed with type 1 diabetes when she was 12 years old. Now in her 50s, managing it has just gotten more difficult and expensive.
With long-term type 1 diabetes, you start having more issues and there's more costs.
Americans with diabetes have medical expenses approximately 2.6 times higher than those who do not have diabetes, and data from the American Diabetes Association shows the total estimated cost of diagnosed diabetes in the U.S. was almost $413 billion in 2024. Christine Falabelle, the director of state government affairs for the American Diabetes Association, says insulin can cost a person thousands of dollars per month without insurance or if they have a high deductible health plan.
Typically, without insurance, the list price of insulin can vary between $200 to $400 per vial, and someone with insulin-dependent diabetes can require up to 8 or 9 vials a month. So it can easily become very, very expensive.
For the more than 3 million Californians who have been diagnosed with diabetes, the passage of Senate Bill 40 was crucial. The new law helps to protect people living with diabetes by prohibiting health insurers and HMOs from imposing a deductible on an insulin prescription drug. And it limits the copay for an insulin prescription to $35 for a 30-day supply. It also prohibits step therapy requirements.
Step therapy is basically a fail-first health insurance tactic that insurers use to save money, where they will cover a cheaper form of insulin before covering the type of insulin that your doctor has prescribed you. And the provisions in Senate Bill 40 will prevent that practice. So people with diabetes will have access to the type of insulin that is most appropriate for them. And this will undoubtedly save lives.
California's CalRx program has also launched state-branded insulin glargine pens, offering significant relief with a suggested retail price of only $11 per pen.
This is crucial in combination with Senate Bill 40 to offer affordability options for people living with diabetes.
The American Diabetes Association was the lead sponsor of SB 40, but grassroots advocacy was also very important in the campaign to get it passed in California. Kelly sent letters to the governor in support of SB 40 and helped get the word out by emailing her large list of contacts and putting the issue out on social media.
I feel like I could breathe a little better. I'm so concerned about not putting money away for the future. I'm concerned about aging, growing older. How am I going to take care of myself? How am I going to continue to afford doing this? And it was a ray of hope.
Thank you for watching our YouTube channel. For more stories in your communities, click the subscribe button right here. You can also download our app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.